The following show and its content are the responsibility of the show's producers and participants.
Information related in this program is not meant to substitute medical recommendations. Before starting a treatment program, you should consult your physician.
T-minus 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0. Ignition. Liftoff.
That's right. Welcome to the Couch Live here. Finally, the Couch Live here. That was a little weird, Trinity. I had a little snafu happen here at WPSN99.com studios here at beautiful New Smyrna Beach. Yeah, Trinity, you weren't turned up yet.
Is that what we're calling it now? Is a snafu?
Well, I mean,
and I don't hear myself in my cans, by the way.
Well,
but that's all right.
What other word do you want to use for what just happened?
I don't know. We can call it whatever you want, old man. And even Richard Coleman, who's watching us on Facebook Live, showed up and said, "Good gracious, it doesn't take diesel engines this long to warm up."
Wow.
Way to call us out there, Richard.
I am street certified dope Dr. Louis Delgado here with you, along with my partner who likes to bust my balls. That's Trinity Phillips, the Dharma guy. What's up, man?
What is up?
How you doing, man?
I'm doing good, man. It's still hot, but hey, what are you gonna do? We live in Florida.
It's a beautiful Friday. It's a beautiful Friday here at Surf Monkey Media, here at New Smyrna Beach. I love the weather that's going on right now, even though it is hot, but it's like a hugging hot. It's like the kind of hot that like hugs you.
I don't know what kind of hugs you're used to getting, because the hugs I'm getting are nowhere near this kind of heat.
Warm
this heat like takes my breath away.
Does it really?
It's like hard to breathe. It's so hot.
Is it really?
It's suffocating.
I guess because I haven't really been outside, so.
Yeah, that helps.
When you got an inside job, it's a little bit different, Trini. Yeah. I mean, we're not working construction out there or anything like that.
No, I mean, and obviously my problems are different than that. Who's digging ditches out there at the moment?
So why are you complaining? There's people out there right now, Trini, that are like real jobs. You don't have a real job.
Hey, man.
What are you complaining about?
I'm not going to lie. I will admit I have gotten soft over the years.
Yeah.
Because I'm complaining about my walk from my front door to my truck.
Exactly.
That's how hot it is.
Exactly.
And yes, I don't care. I'm soft and I don't care.
There's somebody right now hammering some nails, going like, brother, you don't even know.
And you know what? Good for them, and I'm so thankful that they're able to do that.
Yeah. All right.
But I'm still complaining about my walk.
Yeah, you are still complaining though.
It's hot.
All right, so let's get right into it because we had a little delay because of that little hiccup in the electronic internet Wi-Fi system, the interweb.
Yeah.
Didn't like to mess with me right now. Anyway, we're talking about a good topic today, man. This is why I think the government actually they must have anticipated that we were going to be negative. I'm not going to be negative. We're not going to be negative. This is about positivity. This is about solutions. Now, if the numbers are there and the numbers are real and you're doing your job, then we don't have to be negative. And the reality is, we just went to a thing. This is what sparked it up, people. Let me tell you. So Trinity and I go to this event. We get invited to this event here locally. The governor of Florida is there. DeSantis, his wife, a lot of other business figures.
From Seminole
Sheriff
County.
of Seminole County, Demings, which we love a lot.
Demings. Lehman.
Demings was there. Orange County Sheriff and Lima was there.
Oh, I didn't see Demings.
Demings went up on stage, fool.
No.
Yes, he did.
No.
Carol Burkett was there with Demings, and Lima was there for Seminole County.
Thing?
No, man. No, hey, listen, Trinity.
I think you're getting old there, bro.
No,
I don't remember seeing Demings
was there. Lima was there. A lot of good treatment centers were there. Retreat was represented by Enrique. Was there. Jeremy Pier was represented by Perry.
Yep.
Was there, and a lot of others. But anyway, here's the deal. We go there, and David, I know you're off camera and everything like that, but I'm going to speak to you anyway.
David was there too, right?
David was there. David was there representing Crossroads, right? he mentions a different company. You better say Crossroads. But anyway, David was there as well. Anyway, this is what happened. So we go there, and just typical, the government has been having a lot of meetings and a lot of gatherings, right?
Yeah.
Town halls. We know Retreat has put some on down south and up north. There's been put some have been put here. Who was a major player in this? Florida Blue. Florida Blue
yeah.
was there. And then all this jib, jab, deb, talk. But at the end of the day, nobody mentioned anything about how much money.
There was no plans.
And where the money was going, other than, hey, we're just trying to get everybody together because there's a crisis. Hey, by the way, did you know there was a crisis? Hey, there's a crisis. Oh, by the way, did you know there was a crisis?
Yes.
Hey, thank you, Sheriff, for being here because there's a crisis. Hey, Governor, thank you for being here because there's a crisis. Did you know, Governor, that there was a crisis? Oh, great that you knew there was a crisis.
Like a complete waste of time.
Okay, but at the end of the day, they didn't mention anything about what's actually being done. And then at the end, they bring up a mom of someone who lost their son and said, hey, this is why there's a crisis.
Yeah.
And it was like, oh, my God.
No hope provided. No, hey, it works.
Right.
No, hey, let's get people to recovery. I was disappointed that Florida Blue got up there and was like, yeah, we're helping by making sure we don't pay for medications. Medications anymore. That's how we're helping.
We got rid of oxycodone. We will not pay for oxycodone.
Yeah.
It's like, you know what else you don't pay for, Florida Blue?
Treatment.
You don't pay for a lot of treatment. How about say that? How about Florida Blue? This is what you should have. If you really want to help out, how about you get up there and say, we allocated such and such amount of dollars for such and such amount of days for the people that are Florida Blue members.
Yeah.
This is what we're going to do. We're going to increase it by 10%. We're going to increase it by 5%. Say something.
Or how about the money that we save by not having to pay for all those OxyContin things?
We're going to allocate it.
Spend towards treatment or something. Something. Anything.
Something.
Yeah, it was a waste of time.
Right. Or the governor coming up and say, look, last year was this much money. I'm your new governor. This is how much money I'm going to put in. Yeah. How about even mentioning, Governor, that you just signed something that says that we can now have the injection sites. You didn't even mention that you signed something that went into law.
Yeah.
I mean, there's actual things that government is doing. How come they didn't mention it?
I don't know. It was a disappointment.
Anyway, because I heard my voice going up, like a little whiny baby, and I don't like whiny babies. So let me bring it back a little bit. The reality is there are things being done, people. The reality is the government has allocated a lot of money. The reality is that our elected officials, at least at the federal level, have put out a lot of money. So now it's up to these state and local people who, for some reason, chose to stand up there and not mention the millions and billions of dollars. We need to force our local governments to do something with that money that we know they got.
Yeah. I agree.
It's ridiculous.
But that's the thing is the money's out there, but who's it going to?
Right.
And what's happening with it?
Right. So tell everybody who we got coming on the phone, because I'm gonna hit I'm hitting it right now.
We got one of my favorite interviews, Mr. Tom Garafola. I haven't met this dude in person yet.
You've never met
Tom in person? But I've talked to him numerous times. And he's like one of my favorite interviews.
Tom Garafola from Retreat Behavioral Health that has facilities in Pennsylvania and Florida, and is one of our major sponsors. So, Tom, are you there?
I am here, Louis. How are you?
There he is. Can you hear him real good? David, can you hear him on the outside? So for our Facebook Live people, go ahead, Tom.
Is the Dharma guy there?
Yes, sir. What's going on, brother?
Trinity, what's happening, bro?
Not much, man. Good, man. Happy. I was just telling Louis I haven't met you yet. I've spoken to you numerous times, but we've never met yet.
Well, listen, I mean, the legend of Trinity Phillips, aka the Dharma guy, is out there.
The check's in the mail, baby. Sure.
I really think that when Louis opens the show, he should do something like really for the Dharma guy like this. Should be like this big introduction. I was working, and Trinity, I was working on it. I'm stealing this from somebody, but Louis, maybe you should take notes because I think this is the way you should introduce him every day. Is that all right? Can I share that with you?
Yeah, go ahead.
All right, because I think you should introduce him as the heart-stopping, jaw-dropping, earth-shaking, booty-shaking, Viagra-taking, world-shocking,
I can't sign off on that.
Hard-rocking, history-making, legendary Trinity Phillips.
All right. Wait a minute. I was memorizing what you said.
I got it written down for you. If you want.
All right. Good.
I'll send it to you.
All right. So you want me to start over? All right, everybody. Here is the Viagra taking Trinity Phillips. Is that what
there you go? Oh, that's really rough.
That's all I got out of that whole thing.
That's terrible.
I must admit, I was multitasking. I was trying to turn your voice up so everybody could hear it. The Facebook Live people. Now, WPSN99.com, people can hear you perfectly. I just wanted to make sure, because your boss is on Facebook Live, so I want to make sure he can hear you.
I know he's on. Listen. I won't make him happy no matter what. So, I don't raise the bar too high.
Yeah. Well, your jaw-dropping, Viagra-taking Trinity Phillips has this fan right in front of the speaker that actually takes all the noise out.
Oh, you don't blame it on that.
So I blame Trinity and his fan.
Well, that's what I was saying. It only caught the one word. What are you going to do? Trinity, you can defend that all you want.
I'll do my best.
Anyway,
there you go.
Anyway, it's great to have you on, Tom. Tom with Retreat Behavioral Health, like we said. Tom, now, we went to this thing, and I'm sure you've been to these as well, where the local governments or whatever loves to have these town hall meetings or these gatherings of business people, treatment people. This one happened to be about business people and faith-based community, but they didn't talk about actually what they're doing. Nobody mentioned actual real-life solutions to the problem at hand, but instead just kept on telling us, hey, there's a problem. There's a problem, and we need to do something about it.
Well, I think that I shared with you, part of my feeling about it is, and has been for a long time, that this is, what we call a throwaway population. It's an epidemic, and you're hearing it all over the news, and people have to say things, and people have to do things. And I was listening to you before you called, and yes, there is stuff being done. There's money being allocated. But again, this is going to go as far as it'll go, because the population that we're dealing with is one of a difficult group, right? People have always kind of looked at the stigma that they've done it to themselves, or it's a behavioral thing, or it's a moral thing. But I'm not really sure that people understand how much money is being used and what it gets used for.
Right.
How much of the state money is actually being used for treatment beds? Right. Not all of the infrastructure that goes into it, which is obviously necessary, but how much is actually being trickled down for actual treatment? And I don't know that there's any report that really is breaking it down where the average American is going to understand it.
Well, yeah, that's the key, right? That we understand it. But here's the thing: it's so complex because there's so many different variables, right? Like there's so many different pieces. There's law enforcement. There's early detection and prevention.
Yes.
There's grabbing the people when they're in crisis. So it's the first responding community and the emergency rooms. And then there's the actual referrals and getting people to assessment and figuring out what their issues are and what they really need. Then there's the treatment, and then there's the follow-up care, the aftercare, the housing. There's so many different aspects of this, and so many people are incarcerated with drug and alcohol problems. So you have that whole dynamic and that money. So instead of just, again, doing what they did, which is talk a bunch of gibberish and problem but no solution, I figured that today's show we actually should tell the people a little bit about what is going on. Like, for instance, how much money has the federal government allocated throughout all 50 states for this problem, Tom?
Well, I mean, we've looked at this report, and I mean, obviously they're showing what they're allocating in terms of how much money in each state. They identified in this bipartisan policy center report that you shared with me.
Right.
They identified 5 states. And you can see the money is where it's being used. It's broken down.
Right.
But how much is that really being highlighted in any of the conversations? And again, and how much of it is really being utilized in spots where it's going to do the best? And I'll give you, for instance, I worked for several years for the governor in New Jersey for his council, and we were responsible for the funding that came through the tobacco fines that were levied years ago.
Right.
That money was all used for prevention. Mm-hmm. And when you really broke down each municipality and each county's prevention efforts, they were doing things which people got up in arms about because like they were doing stuff like they'd have horse and pony shows for the little kids, and I guess Dare would be there, and that kind of funding. People looked at it and said, "Well, what is it really doing?"
Right.
In the meantime, at the time, I think they were paying. The state was probably paying per treatment bed probably $122 a day or something like that, if I remember the numbers correctly, which doesn't really provide a lot in treatment per day.
No.
Even back in the time I'm talking about. So, it's all fuzzy, and I don't know that you're ever going to get a clear picture.
Yeah, but isn't it in that report? Doesn't it say like $3 billion though?
Yes, it does. 3.3 billion in 17, and it was jumped to 7.4 billion in 18.
I mean, that's billion.
That's a lot of money, man.
Billion. That means
it's
right
billion.
now,
it's billions.
And that was already done. That means by that report, right now we have $7 billion because we're in 18 now.
Yeah.
So that means there's $7 billion or 19. Yeah, that means the last year there was 7 So how much do you think it is now? It's got to be more.
The thing that shocked me, though, to be honest with you, and we had a show, I think it was last week, talking about veteran stuff.
Right.
I'm looking here at the Veterans Health Administration. It was for 2017, zero. Whoa! It goes from zero to like almost 500, 600 million.
Right. Last year.
Last year, but zero. Holy cow!
Well, it's got to start somewhere. What I'm liking by looking at this trend is you see not just a little increase.
No, it's going up a lot.
You saw a dramatic increase from. Now, again, I know people like to knock the federal government or knock this administration, but you're talking about from 17 to 18, it doubled. More than doubled. So here's my question. All you people out there so busy focused on bullshit. There's people dying right now. You should be talking to your local governments and asking them, what are you doing with part of your $8 billion? What are you doing? Because that, my friend, is what I would have liked to hear from a governor of Florida or even from local officials. Say, listen, we got blanketed, because I know in Central Florida we got $82 million we move around. $82 million, and I can tell you where it goes, and it actually goes to really good stuff. Could we use more? Yeah. But we use it.
You can always use more, and that's the problem, and that's really what is the catalyst for people that are not really completely aware of what's going on to continue to perpetuate the nothing's being done mantra, which there's a lot being done. I also heard you talking about the insurance companies, and while there's definitely a lot of beef to be made with some of what you said, the insurance company is always going to go to where, look, we look at everything now, telemedicine, which is needed, but it's becoming more preferred, and the ambulatory method medicine maintenance,
medication,
those types of things they want because it costs less, and they're getting their research that shows that it's doing the same job. We know that that's not the case. So, but there are insurance companies. If you're working with them, if you're trying to work with them, you can at least get the most out of them, because they're never going to give you what you want. 30 days, 20 days, 15 days. What does that do? That doesn't do anything. I mean, it's not enough time.
Right. Well, we want 90 days. We want 120 days. We want a year of treatment. So how about the Florida Blues and Cignas and Aetnas and all of you out there? What you really have a great deal of power in this. You do. But how about come to the table with more of a solution to the actual disease rather than Band-Aid? Because I don't want my insurance company to pay for a Band-Aid for my broken arm. I want a cast for my broken arm. I don't just want the cast. I want the physical therapy for my broken arm. So with other problems that we have in our society, we actually have an initial treatment for the crisis, the critical moment, but then you also have the aftercare paid. So if I go to my doctor and my arm is still not working well, my physical therapist can actually recommend continued physical therapy. You know what I mean? But in our space, it's like you have to fight for every friggin' dollar to continue therapy.
And you're right. And again, Louis, that brings you back to the population,
right?
And the whole stigma, and so it's a circle that goes round and round and round.
Right.
The insurance company's arguments are listen, well, he's been there into treatment 15 times. He must not be doing something. So why we're going to keep investing in it? There's some. It might sound wrong, but there is some validity in some of that, right? In that whole discussion, because we see the population today. They need more time in treatment, but at the same time, a lot of them are so sick, it's very difficult to reach them while they're in treatment for any amount of time.
Well let's look at that for a second.
Very complex issue, like you said. I agree.
But let's look at that for a second, Tom, because how many people continue to go to their doctor because they're obese and they're eating all the wrong food, so they continue to have to take heart medication or some sort of other diabetic issues because they haven't changed their lifestyle, yet you don't get cut off because,
of course not,
because you continue to eat like shit.
Of course not. And I'm not saying it's right. I'm saying the validity in their argument, right?
Right.
Because, and it brings you back to the population and how that population is viewed.
Right. So here's what I do like. I like that people and this is why we wanted to have you on. Retreat actually puts on these town hall type meetings.
We went to one.
Yeah, we went to one. But you guys actually talk about solutions. So let's have a little bit of that platform. Like, what does a program like you, who still wants to help people, but you still have to make money, Tom? I mean, people think that if you're helping people, like, you got to be broke and like you can't make money. Look, if you don't make money, you can't pay for the best doctors, you can't pay for the best therapists, you can't pay for the best way to make a person feel like a human rather than feel like they're incarcerated somewhere. Yeah. So you have very beautiful facilities, but how do you guys navigate this same conversation we're having? You have to shake Florida Blue's hand. You got to shake, Blue Cross Blue Shield's hand in one side, and at the other side, you're saying, "Come on, man, pay me. You got to pay me to do the job." How do you do that?
Well, I would say that might be why Peter's hair is a little whiter and grayer, especially since he's on the radio and listening. I wanted to make sure he knew I knew that.
Right.
But the reality is, again, it's a difficult situation. We do. Even when we came to Florida, we wanted to be leaders in the discussion, in the cultural discussion, and so we spend a lot of time connecting to the community, trying to get the word out there, trying to hold people accountable.
Right.
You do that in the national discussion.
Right.
Privately, we've had several different meetings with the movers and shakers and the powers to be at several different insurance companies.
Right.
We think that we've made some significant progress in working closer with some of them. Mm-hmm. It's a continued juggling thing. It's not easy. We try to offset that a lot of times. With some of the insurance companies you mentioned, a lot of times we can't, in good consciousness, release people because the insurance company stepped them down to a low level of care. So we spent a lot of time and a lot of money investing in, scholarshiping people, even when that's a very difficult thing to do on a regular basis. We were doing a lot of it, especially in Florida, for a long time. So. You do what you have to do. You obviously, yes, it's a business. There is a bottom line, but again, one of the things that I always told people in my marketing efforts was, for us, the bottom line is not first. It is the mission, which is first, because we believe that drives the bottom line. So. We have specialty programs and things that we do for populations and people that are hard to reach, like the Hispanic programming, which is a very much underserved population.
I
might as well take a moment to plug that next Saturday on the 31st.
That's right.
We will be featured for our work with pregnancy up in Lancaster County on Addiction Unplugged.
Right.
And so we're proud of what we're doing. It's a struggle at different times, but for the most part, we think we're making a difference. And
how about this struggle? Tom? Because I remember, I've always had ownership in treatment centers, and I was in network. And I remember if I wanted to keep somebody past the days that the insurance company allowed, when I was in network, you're out of network, they can care less. But when you're in network, it's an agreement. And they would threaten if I would continue to serve them at the same level after they said no, even if it was free.
Yeah.
So there is an issue there where you have treatment providers who don't feel yet ready to release somebody or drop them down a level of service, but the funding source says, you know what, I mean, these benefits have been exhausted. Whether it be right or wrong, it doesn't matter. The point is that the treatment provider then can be penalized for continuing to treat that person at that same level. Now, you have to, at least on paper, say it's a lower level. And to me, part of the system that is broken but getting fixed is there's money. If there's money out there, that money that we hear about, like that $3 billion and $7 billion that we heard, by the way, people, that's government funding. That means private providers like Retreat don't get any of it. That means all the private facilities don't get any of it. And what I'm proposing, you heard it here first, kids. What I'm proposing, because in disease, if it's really a crisis, if it was Zika or some other thing, we'd have tent cities all over the place. If it was a real crisis, we'd have tent cities where anyone can come and let's get them all help and let's resolve this. Everybody would be getting delivered Narcan at their house. Everyone would be getting delivered some sort of medication assisted treatment at their house or something. That's not happening. So we're not treating it like a real crisis, but we are throwing money at it. So if we're going to throw money at it, why not allow...
Real quick, though, real crisis, 190-some people are dying a day.
A day. In overdose. That's overdose alone.
Yes.
That's not other stuff. Now, why don't we, as private providers, say, listen, I got 30 beds. I am willing to take the same fee that you give these public beds for 1 bed a month or 2 beds a month, because you already scholarship. Retreat Behavioral Health already scholarships. So why can't Retreat be able to get a voucher to resolve our because the problem with public beds is you only have like 7 to 10 of them. So they're full, but there's still money. Since there's still money, but there's no beds, how about going to private providers and purchasing beds from private providers and providing a voucher during these years of crisis until the crisis is considered no longer a crisis? I'm just saying, if you really want to treat this as a crisis, provide a voucher that the citizen can go to a private provider and go to a private provider that's willing to take that voucher. What do you think about something like that, Tom?
Well, listen, I think just from a business standpoint, I think every good and reputable and unreputable company will be getting online to be part of that voucher system. And I think that's a suggestion for part of a solution.
Right.
And obviously, I like it just because it affords people to get into treatment a little easier, which is really what it's all about, getting access to treatment.
Right.
Again, I go back to the first thing you said, which is this is a very complex issue.
Right.
So, I mean, and there's more monies that could be had if you look at, the pharmaceutical companies that are now being sued,
right.
which there's a whole nother commentary on that, really.
Right.
But that money, just like the tobacco suits that have been funding states for years and years now in substance abuse prevention and stuff like that, that's all money that could be used for a voucher system.
Right.
We have some questions.
And I think they should be a lot more aggressive in going after that. But that has to do with power and lobbyists. And,
right.
So it just keeps getting more and more complex.
All right, Trinity said there's a question from what, Facebook Live?
Yeah. There's actually there's a comment from Jack that says there is no such thing as government funded; it's taxpayer funded. So, and I guess
but people are taxed. People are government,
and that leads into Richard's question. Was he says, "Are you proposing socialistic rehab services?"
No, I'm not. I'm not socialist in any way. I'm a capitalist. What I'm saying though is, if you're going to say crisis, and you're going to throw $8 billion at a problem, and we know treatment does work, and you have facilities like Retreat who have proven methods that do work, and they follow up with you. So they stay with you from the beginning all the way through your lifetime. right? Because there's what do you call it? Alumni programs, right? So if you're set up that way and you've already been vetted by government, by insurance companies, by accreditations, like if you're JCO accredited or CARF accredited, then you should be able to approach, or government should be able to then create a voucher system, since they're throwing billions, but they're throwing it only to nonprofit organizations that always get the grants. So the same place that always gets all the grants for homeless, now they're jumping in the substance abuse games. They jump in the mental health, like they get all the grants. Yeah. Nonprofits that deal with government funding always deal with all those grants, whereas there's a lot of private providers.
We're just better at it, I'm going to say.
Well, the thing is, because they make more money, they're able to pay for the person that got started at the government place, but then they're such a good therapist or they're such a good doctor, or they actually want to feed their family with what they make for a living, so they go work for a private provider. Okay. So why doesn't it make sense to then, if you're in a time of crisis, to bring them into the mix? Allow them to be part of the solution, because right now, insurance companies run private providers. That's just the way it is. Yep. Tom, what do you say to the
I listen, I don't think that's a socialist proposal, what you proposed anyway. And again, it's money that's being put out there already.
Yeah, it's already out there.
We're just talking about how you're redistributing it.
Right.
And at least that's the way I understood your comments. But again, I will tell you, I want to just, in New Jersey, right, the new governor, who's very left, very liberal, but in
Pennsylvania?
New Jersey.
In New Jersey.
Oh, okay, Jersey. Okay.
In Jersey. Part of the proposal to address the opiate epidemic included fees on different pharmaceutical companies for distribution of pain-related medication. People shot that down right away. Right. But at the same time, there's a big part. They've had a big part in where we are.
Right.
They're all getting fined, and I think that's some of the money that could be used for, if you want to get away from the whole socialist thought.
Right.
It's money from something like that.
Right.
That also could be used.
Yes.
Listen, just personally, right. I mean, people that go on welfare, I think that there are measures and stuff that should be used for them to continue to collect welfare, right. and additional handouts or whatever, however you want to term it. Right. But people are dying, and we're calling it a crisis. Right. And I agree with you. We should utilize the money and best that we can, and who's really tracking it.
Look, in reality, one of the hardest persons to help is a person from a family that it's never used government assistance, so they don't even know how to access it.
That's right.
So they don't even ask. They have insurance, but they have this high 5,000. Man, when you help some of these people with these Obamacare policies and you see a $16,000 deductible.
Or 25, I think it was.
25 was the highest that we saw, I think. $25,000. Who can afford a $25,000 deductible? How does that even exist?
It's ridiculous.
And these are people, and let's say these are people at work. They're actually better off not work. They're actually better off not working and going into an emergency room every time they have a cough.
Yeah, not once as either side of the aisle talked about address that system. I hear a lot of conversations about healthcare, but you know what you guys don't ever talk about? You guys they talk about healthcare all the time in the government system. You never talk about how come the deductible for this kind of care hasn't been addressed. You can specify in times of crisis, governments change rules. Yep. They just do. FEMA comes in, right? Like when we had that problem here in Orlando, right? All of a sudden, everybody lost their electricity for who knows how many days. Well, what did FEMA come in and do? Buy everybody groceries and that lost money. So why aren't we responding to this crisis that way and just come up with ideas that just are completely different? All for, okay, from right now, how about zero deductible if it's your first time in treatment, if you want to judge others for being in treatment 5 or 10 times. But come up with some solutions that allow people to access care. Here's what I don't like, Tom. And you can, what is your capacity? I mean, what is your total capacity as far as beds?
Currently, it's somewhere around 300.
Okay. So out of 300 beds, what's the average throughout a inpatient? What is the average fill? Like, if you don't want to say, that's fine, but you could tell me like the average fill for all treatment centers. What is it? 70, 80%?
Right now, if you went based on what you're hearing across the board in our industry, 65, 70% is the new 100%.
Right. All right. So 65%. That means you have 35 to 40% of empty beds.
Yeah.
You got people on waiting lists for public assistance for those same types of beds.
Yep.
You see where I'm going with this?
Yeah.
Wouldn't it be better to have them filled than to be emptied?
It's a logical argument, but when you're talking about government and again, I go.
But we
back
are government,
unfortunately. Yeah. Well,
but that's the thing. We are government. Instead, when we go to these town halls, what I'm saying is, in these town halls, we can't wait for government officials to come up with responses. Look, government officials are always campaigning. That's what they do. To anybody that believes differently, you're wasting your brain power.
Yes.
They are always campaigning. So
that's right.
We, the treatment professionals, know what we would love to have to do. We have the wish list. So why aren't we gathering up together as one lobbying power and saying this is how we make change?
It's a good question for people at NADAC and NATAP and listen, I'm sure that there are enough facility owners or the powers to be that would like to be involved in that whole discussion and see how to make that work.
Yeah. I mean, listen, the sad reality is, treatment does work. Recovery is possible. So that means there is a solution. If you're watching or listening to this program right now, you can get out of the problem that you're currently in. You can get help. I know you're not hearing it. I know it doesn't sound like there's any help out there. I know it sounds like nobody cares. I know it sounds like there's a lot of judgment of people saying that you deserve this and that just get over it, kid, shake it off. But the reality is there's a lot of facilities out there that want to help you. The reality is that private facilities, scholarship, millions and millions upon millions of free bed space that they never get tax breaks on. Your tax break isn't high enough to accommodate how much free beds a place like Retreat gives away. You know what I mean? Yep. It's like you probably don't even claim it because it's a waste of time to even claim it. Yep. Now, the government is able to then also say, well, if you give away this much bed space, here's an additional tax break we're offering for these facilities. They do it if you want to move into a city. If you were making some sort of textile that the government needed, and you were going to provide 3,000 more jobs, the local government or federal government will give you tax breaks to move into that city.
Yeah.
Yep.
But instead, what treatment providers get is, we don't know if we want you in our town. We don't know if we want those people here. Instead of offering us tax breaks for opening up treatment centers, they actually judge by using stigma against us. There's another problem.
Yep.
I mean, you guys just opened up in Ohio, didn't you, not long ago?
Who, us?
Yeah.
No, we're opening in Connecticut.
Connecticut, that's where it is, Connecticut. So, I mean, I'm sure you guys had to deal with local residents in Connecticut and people that might have thought, differently about wanting to put a treatment center in there.
Listen, it's been a long journey to finally get it to be opened in Connecticut. So, yes, we understand some of that wholeheartedly.
Right here close to my house in Orange City. I know that there's several facilities tried to open up here in Orange City locally and always shot down. But you know what there is in Orange City? There's a poker room. There's a poker room and a gambling facility in Orange City. But you know what's not allowed in Orange City here locally? A treatment center. They don't want those people here. These are the things.
Yeah.
Yep.
There's liquor stores there too.
There's liquor stores.
That's unfortunate, Lou. They still exist. NIMBY is still very strong, right? Stigma is very strong. Not in my backyard.
Right.
They did it to themselves. We're more educated, but I don't know that we're so much further away from that thought process.
Right. So everyone out there, I think what I really what we really want the message to be coming out of the show is your federal government is throwing billions of dollars at this problem. Your federal government, which is all of us, are responding with money. But our local governments and our local people, because the local government is made out of you. You right there that's sitting on your couch, or you right there that's driving in your car. It's you. You are government. You have to get involved. You have to reduce the own stigma that you have in your own brain about this problem. And you got to do something more than just focus on what's happening at the federal level. I'm sick of my timeline being filled with people complaining about federal level. You know, this side, that side. Look, that Ocasio-Cortez has nothing to do with my life. Nope. Zero to do with my life. President Trump can't help my life. They already did. There's the money. You know what can help my life? Local government officials who can allow a treatment center to open up, who can create a voucher system, who can allow needle sharing program. I mean, not needle sharing. Free. What's the needle exchange programs? Who can provide Narcan to people, who make sure that all their officers are fully aware of the dangers of touching any white powder.
We need our local ones to actually sign it because it was already passed.
That's right. Do you know this, Tom?
Yes.
You know that right here in Volusia County, where we are at Surf Monkey Media Studios right now, the Now Matters More Foundation has agreed to partner up with the local sheriff's department. Can I say it just right here? Can I just do it?
Yeah, why not? Go for it.
We've agreed to help sponsor them in a way that we are going to purchase 5 take-back boxes. Do you know that Volusia County has no take-back boxes for pills?
Holy crap.
They will now.
But they will now.
They will now.
They will now. They have so much red tape that they got to go through, but we don't. So we go to our donors, we go to our sponsors, which, Retreat is always one of our sponsors whenever we put on a thing, right, Trinity?
Yep.
We do a golf tournament, there they are, we do this, So because of people like you guys, we're able to do differences here locally on the street because they get 4 tons a year when they do a take-back day. 4 tons! Yeah. How much more can they get if they have, like, permanent boxes?
Yep.
This is making a difference.
I think the point you're making really is that it does take work out of the community. You can't really wait on your government. We came out of the Depression because people survived the Depression because of what the communities did.
Damn straight.
What people in the communities did. So it's the same thing.
Damn straight. Stop complaining. Look, I know puppies are cool, and I love puppies, and we're all dog guys on this show, and I know, Tom, you're a dog guy. We've all lost puppies recently, so we're all always in mourning of our little buddies. But at the end of the day, we got real people that it's easier to raise money for puppies than it is for people.
Yeah.
Real quick,
because puppies are warm and fuzzy.
They really are. They're so damn cute, man.
But Trinity's warm and fuzzy too. So I don't know why.
There you go.
He looks good and green, and if that beard gets any longer, I'm gonna get nervous.
Right. Jack was asking how much do the take-back boxes cost.
Why, you want to buy one, Jack?
Yeah, there's 2 different ones. There's a bigger one and a medium-sized one.
Yeah. Do I know this, Jack?
Jack Davis, yeah.
Oh, right on, Jack. It's right around $900 a box.
Yeah. And we're as a foundation, we're helping them with 5 boxes.
5 boxes
that are going to be put inside the local police station.
Anybody wants to help with that, please. NowMattersMore.org. Hit the donate button because obviously that's a lot of money. But we felt that would actually help the sheriff's department, who really needs help. They need our help in getting some of this off the street, because they're the ones that have to scrape our kids, and they have to pick our kids off the out of the house. They're the ones that have to go in there and see dead kids all the time. Our local law enforcement and first responders see this every day.
Well, and I will say the 2 guys that were here that we're working with, they get it too.
They get it.
Yeah, and I want to say in terms of the law enforcement thing, where this whole discussion that you've had, when you look at yesteryear and now in terms of how far we've moved.
Yeah.
The police departments have moved probably further
than anyone. You're right.
Than any one type of organization. They're bringing people in, telling people, we want to get you help. We're not going to lock you up because you've been loitering in this neighborhood. And they're offering help. It started out in Massachusetts, and it really has picked up. And I think that they need to be recognized for their efforts in trying to deal with this the way we're talking about it being dealt with.
You are so right. The legal system, as far as if you look at how many places have drug courts, if you look at how many judges are a lot more treatment-oriented rather than punitive-oriented, you look at how many law enforcement people, guys that actually arrest you, are actually more aware of how to help you. Than ever before. We have spoken for HIDA, which is High Intensity Drug Trafficking Association. We've spoken for the DEA. We've spoken for the Sheriff's Department. We have been approached as the Now Matters More Foundation or as individuals to speak at these places to law enforcement so they get it better. And they absolutely know they can't arrest ourselves out of the problem. They know they need us, but they have to be good at what they do, so they need the money for what they do as well. You know what I mean? And for them for them to be spending time, like to meet with us, Trinity, to ask about take-back boxes instead of going out there arresting, we got to arrest these. They didn't talk like that.
No.
They were like, how do we help them from themselves?
Yeah.
It's a huge paradigm shift.
Right.
And again, I think that the men in blue and the women in blue, they need to be recognized for that.
Right.
Their job is to protect and serve, and a lot of times they're dealing with in very bad neighborhoods, and yet still their paradigm shift has been, let's try to help these people who want to get help.
Right.
Yeah, but the sad part, though, is out of that $82 million that's helping Central Florida, they had to come to us. That's the problem.
Right.
Why'd you have to come to us as a nonprofit when there's $82 million sitting out there?
Because we don't go out and get those grants. The people that get those grants, look, maybe they're doing their job, and that's great. I'm not trying to say they're doing it poorly or they're doing it wrong. I'm just saying that the average person that needs help is not. For some reason, there's this image that everybody that has drug or alcohol problems are all the people that use public assistance. No, the average person, the average families that need our help for this crisis are actually middle-class people with some insurance, but not much insurance or not enough to get what they
underinsured.
Get. They're underinsured, exactly, that's the word. Or they're insured. Look, we can't just look at people that are completely broke. We got to look at the people. The reason they're broke is because the drug addiction took all the family's money. That's why they no longer have money. That's why this person doesn't have insurance, because they're spending all their money on heroin or they're spending all their money on something else. We need to address that middle-class population, people. If we don't help the middle-class population, this is where we get to. The reason we're in an opioid crisis is because middle-class people are dying.
Yeah.
Broke people have always been dying. Rich people have always been dying. That's not different. Rich drug addicts and poor drug addicts have always existed, and they've always been dying. The new population that is dying is the middle-class population that nobody expected to die, which was the soccer mom.
Yeah.
Well, that's why you have light on the problem now that you didn't at one time. So that's where the progress is.
Correct.
Unfortunately, when you're talking about the youth of our country dying at alarming rates.
Right.
And so you can never get there to save that fast enough. You got to keep.
Right.
And it takes the community.
But
the middle class has to get out for the middle class. Everybody has to get out and do the work.
But my problem is that, all right, so look at those two populations, right? Rich and broke, right? Well, when they throw government money at a problem, guess who's getting all that money? The broke. They're not giving it to middle class people. That's why I vote for a voucher system where average day Americans that are used to not asking for help. We don't know how to ask for help. I wouldn't even, if I needed food stamps right now, I don't even know who to call. I have no idea who to call. I don't know that system. And I'm not blaming anyone for knowing that system. I'm just saying the average day American does not know how to go to a food bank, does not know where the food bank's located. They don't know how to get free clothing. They don't know how to get their electricity paid for. They don't know how to apply for Medicaid or Medicare. Medicaid. They don't know how to get government assistance. They just don't. So if you throw $82 million just at that population, or you throw $8 billion just at that population, you're missing the picture.
Good point.
You got to get to the average day American who is underinsured.
Yep.
That's my point. There is a solution. There is money. It needs to be reallocated. And private practitioners need to step up and start grabbing some of that government money and stop depending. We can't just wait for everybody to be homeless to help them.
No.
The people that have worked in the homeless business for decades still can't help the homeless.
No.
So we got to get them while they still have a home. Anyway.
Good point.
Anyway, Tom, last couple minutes. Tell us something about, you guys have been so good to us and so good to the populations that you deal with. Say anything about Retreat You Want. Here's your minute.
Well, thank you. Obviously, we spent a little time just highlighting the things that we're doing. Again, I want to just point out this coming Saturday, the 31st, or next Saturday, we will be featured on the new show, Addiction Unplugged.
Right on.
And our work with pregnancy, people that are suffering from addiction and are pregnant. It's another population that's
huge
pretty
population.
underserved. It's a huge population because it's affecting 2 people at once, right?
Right.
But it's an underserved population. We positioned ourselves very early on to work with that population. We have an OBGYN on staff who has helped us navigate and get to where we are. We can take pregnant women up to 36 weeks of pregnancy.
Mm-hmm.
We can help them deliver a safe and healthy baby and get their lives together. So pregnancy and Hispanic programming right now that we're working on, again, it's a very underserved population. We are trying to make inroads to reach those populations. So we're excited about Connecticut also. It's been a long journey for us. It looks like December of this year, we will finally open our doors to a beautiful new inpatient facility. Connecticut is in desperate need of more treatment beds. They don't have many, so we're looking forward to. We're excited about that.
That's awesome. I like that you guys are taking it back up north because, there's so many people up there that are afraid to send their kids to Florida, and Florida has really corrected itself in a lot of ways, people. So you got to get over that, too. But if you do have that fear and you absolutely will not send your kids to Florida, guess what? There are programs in other states like Pennsylvania, Retreat in Pennsylvania, and hopefully the other one in Connecticut opens up soon, so you can send them there. Closer to home, maybe you can go visit, maybe you can be a little bit more part of the therapy, whatever it is.
That's really where the treatment industry is headed to. It's cyclical, right? We're going back to where it used to be. Everything is in the communities. And you're not going to see people getting on planes to Arizona and California from New York,
Right.
So, that's my minute. That's what we're excited about. That's what we're doing. And please visit our website and see what else we might be doing that of interest to you.
Yeah.
Always a pleasure being on the air with you, Trinity.
Right on.
You are a legend, my man.
Well, yeah, Trinity, he says. I'm nothing over here.
No, you're the dope doctor. You go without saying. It's your show.
Whatever.
It's like it's like a Mexican asking Richard Pryor, how come you don't rank on me? It's because you got your own country. What am I going to rank on you for? Right?
God, I love this dude.
I love him too. Hey, thank you very much, Tom. Your phone number and your email, your website will be listed right here across the bottom while you're talking during the entire show on the YouTube segment.
I can promise you in the next 30 seconds I will be getting a phone call from Lake Worth. I'll talk to you in a little while.
All right, brother. Thank you very much.
Take
Tom.
care, guys.
Right, bye-bye. So that was Tom Garafola. Trinity, last words?
Yeah, just a real quick summary, man. The money is out there more than we thought.
Yeah.
It's just kind of disappointing as a local voter that we're not seeing it filter through the rest of the local stuff.
Right.
And so I think that for those of us in the know, we need to talk to the people who aren't in the know.
Right.
And vote. We need to go out there and make our intentions known with our votes, because I do think it's unacceptable that this much money's coming out and it's not being allocated what I think to be appropriately.
Or just communicated. It's just not being communicated. I think if the government would learn how to communicate, our local government I'm talking about, if local people would learn how to better explain what they're signing. Like DeSantis just had to come up and say, look, I signed this the other day.
Right.
This is what it will do. If you guys want one now, guess what? You can have one now. He should have came up and said, guess what? You guys can now. You guys need to vote on it here locally. You guys need to decide here locally if you want a needle exchange program. That's what he should have said.
Yeah.
Just come tell us. I just okayed this. You can now do it. You guys voted on it on a state level and voted it to pass. So if this community thinks like the majority of the state does, then clearly you want one. So I just signed it the other day. Good luck with it. If you need my help, let me know. Right?
Yep.
Anyway, listen, people. Help is out there. Solutions are out there. But nothing's going to happen if you just listen to something like this or hear this and then just, complain and whine like I was doing earlier with no solution or nothing. You got to back it up with something. Well, here's how you back it up. You become involved. NowMattersMore.org. You can help us as a volunteer. You can help by sharing some of our messages. You can help by letting people know we exist. We can't financially help everybody, but what we can do is we can take donations from everybody so that we can help as many that need it as possible. So we need you to donate. And if you want to donate, $5 a month, then donate $5 a month. You want to donate some large sum, then donate some large sum. You have a vehicle or a piece of property or something, you say, look, I don't have money, but I got this, then donate that. Talk to us. NowMattersMore.org. 833-NOW-MATTERS is our phone number. Call us. 833-NOW-MATTERS. We are here for you. Everyone knows somebody. You, right now, are thinking about somebody. Let us help you. Tell a friend. Follow us on Facebook. Follow us on Instagram. Follow us individually, the Dope Doctor or the Dharma Guy. We're here for you regardless. Not just today while you're in crisis, but for the years and years after, because that's what helps us keep doing this. Because the people that come back and say, look, I have 5 years clean, I have 10 years clean, it really does work. So anyway, anything else, Trini? Is that it?
I think that's it, man.
All right, everybody. Adios, amigos. It's time for a taco. Thanks again to Retreat, and thanks to our good friend Tom Garafola. Goodbye.
And that was without even a single drop of rum.
That was awesome.
He really grows on you, doesn't he?